skeleton really gives us that clear, almost simplified version of the directions, if that makes sense.
Let's try it out, Michelle. Do you want to give Janet a position or way of showing what you're thinking about?
Yeah, well, what I'm thinking about is, so maybe Jan, I think she did it before, where you can go inside the ribs themselves and show the directions. So when we breathe, like, I remember one direction Martha gave us was that the sternum went toward the floor and the chin came down. Yeah? Mm-hmm. That guy needs an FI, dude. His chin going away. Yeah. Mm-hmm.
And Janet has shown before the ribs have a stretchy connection.
The cartilage.
The spine, the cartilage, so that it allows for, sometimes we talk about it as a rib cage, but in the Feldenkrais world, we often talk about it as a flexible basket. I also had a teacher who talked about it as an accordion, the rib accordion.
Yes.
So you can see that how much the breath can open the ribs.
Yeah.
Just breath alone.
And then, of course, we have the left and right of it all. The ability for it to almost like squeeze, and then accordion lengthen and shorten, of course. Yep. Mm-hmm.
I'm interested in seeing what the movement of the the effect the rib cage movement has on the spine, in the neck, and the thoracic and the lumbar spine. So can you continue that movement, Janet, so that we can see how it that movement is reflected in the spine itself?
How do you use that in up and down or sideways? I didn't.
No, just do what you were doing with your hands on the outside of the rib cage and breathing so that the sternum comes up and down and the chin, you know, just exactly what you were doing for Michelle.
All right, like this and this.
Yeah, or from the outside, either way. But you can see how the movement of the basket, as Martha was saying, affects the spine. I'm especially seeing it in how it affects the neck. Yeah, that's great. Thank you.
So we'll take additional questions, but let's go ahead and look systematically at Fred doing the movement part of the lesson. And then I also want to see how Fred uses his thinking and imagination to see how he wants to roll to the side and sit up. So we have Fred's left hand behind his head, the spot where his head meets the floor. And then Janet is very acrobatic and is going to also be able to lift the knee. Beautiful, Janet.
All right.
So let's even, yes, and you can let him rest for a moment. We can just look at the pelvis as that knee comes up. And maybe bring the hand and the knee apart so people can see as the knee comes up over the chest and the hand comes to meet at what happens in the pelvis and how the pelvis is connected to the tailbone. So you want to bring them together and bring the hand up. You see the movement in the pelvis. So even there, you begin to connect the movement of the pelvis to the upper body. Thank you, Janet. And now are you game to see if you can bring the elbow up towards the knee too?
Good job.
A lot.
And I think we can see that perhaps his knee comes a little more easily. No, she's got it going. So the idea that one might lead, the knee might come first, the elbow comes second and a little less. They might come together. So this is the same side. And you can see the movement in the pelvis, a little bit of movement in the spine, right at the lower lumbar. Fred's a little stiff. And now you can see the rotation in the ribs. You can see that his chin is coming down. And then the sternum is coming down.
Wow.
And if he's thinking of getting long, how that movement works. And if he's using a lot of force and maybe a muscle work in his arm to grab his head and pull it up, different kind of movement. Then if he lengthens through the spine, gets a little taller as he comes forward, head almost lifts on its own. And can you see that the more that the ribs and shoulder blades would be pressing into the floor, perhaps the lighter it is to move the knee and the elbow towards each other. And then Janet and Fred might want to take a rest. And then if we can have him go on the diagonal, whichever side is easiest for you to do. Did anyone find differences in when they shifted to the diagonal? So the opposite knee and elbow are coming towards each other. It's a bit more of a twist through the spine. And the ribs go along with the spine.
You see a little bit more of that twist, Martha?
Yes,
I
thank
just
you.
need 2 more arms.
The four-handed skeleton demonstration. Thank you, Janet. And then if we let Fred come to lying, sometimes in our lessons we focus on the specific movements and less on the transition back from sitting to standing, sometimes more, sometimes less, and the habits that might come to mind. And some of us might have a habit, we could maybe show it, that we just poke our heads up, where is all the work done? How is the work distributed and who works the most if you just pop that head up first?
And up
Yep, lift them up and a little to the side.
to the side.
So lots of work right there in those very delicate neck vertebrae. But if Fred starts to roll, lets the head stay down, what if his left arm comes up on his chest And
Say
the
that
left,
again, Martha?
the left arm is coming up on the chest, so he's ready to give a little roll from the top. And since you're on that end, and if he's rolling to the side towards you is where I'm going, Janet.
Oh, okay.
And since I don't think it's worth having you move, but you can envision that if he starts to push with the left foot and lift the left knee, he can roll over to the side without driving it from the head and the neck. It's just one habit Fred might have that some of us have, to pop the head up and do a lot of work in the neck and head, more evenly distributed. And then he can begin to come up, letting the neck still stay fairly soft, pushing gently up with the arm. And look at how much movement there is in the spine and the ribs and the pelvis.
Sorry.
I think that's great. I think we'll stop there.